afternoon. My name is Kelly, and most of you may know me as Dr. Prasad's receptionist, but today I am his patient. When I first started working here, I believed in plastic surgery, but I didn't think that at the time I needed it. After seeing Dr. Prasad's patients, I realized that I could actually be one of them. I know, I'm 22, so for some people you're like, really? Eyelid surgery? But it's not about age and it's not about what you look like. It was something that I knew would make me happy.
Kelly is young, so there's not a lot of aging changes. So what we want to do is retain a natural appearance to her eyes. So I'm going to first identify the crease. This space right here is where you apply eyeshadow. And so that will be the definition. And nature gives us a crease so that it is, as we get older, it gets less defined, but when you're young it's pretty well defined. And so I'm going to basically follow what's already there as the starting point.
I knew that Dr. Prasad was the right doctor to fix that for me. He is excellent at what he does. He's a master of his art, and just like any artist could draw a picture, Dr. Prasad can fix your eyelids.
Now the art of eyelid surgery is deciding how much to do as well as how much not to do. So when I'm looking at her, I'm asking her to open her eyes, and I like to do my drawings with the patient standing up because we're vertical, and when you're laying down everything kind of shifts up and back. So with her standing up, I can confirm that the crease is in a nice place based on what I saw with her eyes closed. And now I look at her and see how much extra skin there is. And skin is not the enemy. It doesn't mean we have to remove all the skin. What we want to do is to look young and natural. So if we take off too much skin, it can actually make you look older. Okay? So what I'm doing now is measuring a certain amount of skin that I'd like to reduce, and at the same time not take too much. And this is where the art is, because technically she has enough elasticity in her skin to be able to remove a lot more. So we almost have permission to take away a lot, but really we don't, because then she'll look like she had surgery. So what we want to do is to make her eyes look more open and more natural. And this is where experience and artistry are very, very important. Essentially anybody can take away skin, but taking the right amount of skin away and doing it in a way that looks nice and natural, that's judgment that is, I feel, intrinsic. And of course, what I like to do is create enough space on the outer aspect of the eye so that you can be able to apply eyeshadow and it'll look very nice. At the same time, we don't want any scars that go outside of the natural shape of the eye. If you go to any restaurant or look around the city or Long Island, you'll see a lot of people walking around with the incision line out here because the doctor, when they did the surgery, drew it in a way so that the scar went outside. So again, she's young. We don't want her to look like she's had surgery. So with this design here, it flows and tapers and it matches. It's right for her face. So now I'll do the same thing on this side. It's important to realize when you look at eyes that very few people have 100% symmetric eyes. And you realize that when you're doing the drawing that there are subtle asymmetries. On Kelly, her left brow is a little bit higher than her right brow. And bone structure has an effect on how these areas are manifested because the soft tissue or the skin drapes over the bones. So compensating and trying to maximize the symmetry is also important. But again, we are naturally a little bit asymmetric. Like that. Okay. So there's a lot of heaviness on the outer aspect here. There's not much over here, so it's almost graduated where we take a little bit more as we go out, so that when everything is done, you'll actually have more of an eyelid. See that? That'll be nice. That'll be nice. So that's what we can expect. Okay? All right, so we get to work now.
I am 4 days post-surgery. It seemed unbelievable to me. I was literally fascinated with my results. I'm back at work after 4 days, which most people were even shocked about. I got a call the next day from the nurse and she said, "When are you going to be back?" I said, "Tuesday." She said, "Really?" I said, "Yes." And I knew it would be possible because honestly, I was stunned by the fact that I didn't look like I had surgery. I went to Wall Bombs last night and nobody even looked at me like I was crazy, which most people would think they would. I am back at work feeling fine and I am ecstatic over my results.
They really look good.
They do.
It really, it's for 1 week.
I can't believe it.
Yeah.
I really can't. I feel like I don't look like I had surgery. Someone wouldn't say, "Hey, did you have plastic surgery?" But I look different to myself and I'm so happy about that because I have an eyelid, which I didn't have before. My sister couldn't believe it. She said she can't wait to do my makeup, which is exciting for her. But I just wanted everyone to know that I feel great and I'm excited. This is my 1.5 post-op video. I did my upper eyelids because I had a lot of extra skin. And people were always saying, "You look tired," or when I smiled, I literally didn't have an eyelid. I would wear makeup and you couldn't tell. So I made the decision to do this, and I'm so excited to be here talking to you guys about this because it has made such a difference for me. The funny thing is that people will see me and nobody knows the difference. My friends haven't noticed, family members that didn't see me after the surgery haven't noticed, and it's just like, I like that in a way because he didn't change my look, he just enhanced it. So I'm so excited. I've been wearing makeup every day basically because now when I do, you could see the eyeshadow. My eyelashes are up, my mascara looks wonderful, and that's just like something little that comes along with it. And I don't look as tired. I feel like I look awake and enhanced. I don't look different, but I definitely look better, and that is why I'm so thankful to Dr. Prasad for this. It's the upper eyelid surgery I had done. It gave me that natural crease that most people don't have to have surgery to do, but I was a person that did. The skin that hung over prevented me from having an eyelid. Basically, before the surgery, one of the nurses said to me, "When you smile, you don't have that look that most people have." So now I've gained that natural crease just from doing the surgery. I'm actually an aspiring actor, so for me, your looks is what sells you. You need that in that business. And I feel like Dr. Prasad gave me an opportunity to enhance my look, and I'm very excited about that because you want to look your best. It's important. You're on camera. People are looking at you. That's what they're judging you by the first step you walk in the door. So he gave me an opportunity to give them something a little better to look at. I look awake. I look alive. I look like I'm ready to be there and like I slept last night, which is important. It's something that everybody wants, but especially someone whose look is something that, is imperative in their career.